Welcome to the Bodyguard podcast, where science meets natural healing to uncover the root causes of complex health issues. Your host, Christine Barnes, is a leading complex case health practitioner specializing in functional testing and personalized care. This show dives deep into clinical analysis, cutting-edge diagnostics, natural therapies, and holistic strategies to optimize your health and well-being. Your health is unique. Your healing should be too.
Today's topic is not your usual dinner table conversation, but trust me, it's one of the most important indicators of health. We're talking about poo and what your poo says about you. Yes, your daily or not so daily bathroom habits hold critical clues about your digestion, microbiome, metabolism, immune system, even how you think and feel in general. So if you've ever wondered, is my poo normal? Why does my gut feel a little off? How can I improve digestion naturally? Then stick with me, because during this episode, I'm going to be talking about how to read the signs your body is giving you. So let's take a deep dive. Your gut is the foundation of your overall health. It's got a big job on its shoulders. It's responsible for digesting food, absorbing nutrients, eliminating toxins, supporting immunity, and influencing your brain function, cognition, and mood. But here's the thing. Your gut is always communicating with you. Are you listening? So what are the signs of an unhappy gut? Bloating, constipation, or diarrhea, changes in stool color or consistency, unexplained fatigue, and even hormone imbalances and skin issues. Your stool is giving you real-time report card on how well your digestion and detoxification systems are functioning. So let's break it down a little bit more. What does healthy poop actually look like? So commonly, the medical system uses the Bristol Stool Chart. What type is your stool? I'm going to go a little bit further or deeper from a naturopathic perspective, but it's a really good place to start. And you can Google Bristol Stool Chart. You can print that off and have it on the back of your toilet door, just to give you a bit of an idea in getting started on monitoring your bowel movements. So the Bristol Stool Chart categorizes poop in 7 types. Type 1 to 2, hard, dry, pellet looking. That's an indication of constipation. Often it's caused by dehydration, but also can be a combination of dehydration and or low fiber intake in your diet. It also can be due to stress and general sluggish motility. Type 3 to 4, which it looks more smooth, well-formed, sausage-like. Now, the Bristol Stool Chart says that's optimal. This is what you're aiming for, but naturopathically, we like to look a little bit deeper. But certainly we want to target regular, easy-to-pass stools, and one indicator for that is if we're dehydrated or well-hydrated. So types 5 to 7 is it presents more loose, unformed, mushy, can be watery. That's what we classify as diarrhea or malabsorption, or a combination. And that can be a result of potentially gut inflammation, food intolerances, infections, imbalanced gut bacteria, which could involve either deficiencies in beneficial bacteria and or pathogens. So what's our goal? So Bristol Stool Chart, that's such a big term to get around. Bristol Stool Chart is type 3 or 4 is what the medical system suggests is our goal. But naturopathically, we'd go beyond that. So we're sort of looking, does it sink in the toilet bowl, or is it floating on top? So sinking means that we've digested the fats, there's not excessive gases, and we also want to look at the length and diameter. So ideally, we're seeking 8 to 10 inches long or 20 centimetres long, and 1.5 to 2 inches or 5 centimetres in diameter. We want it a chocolate brown in colour, not light brown, not too dark, but a nice chocolate brown in colour, and no oily residue floating on the top of the water. Even if the poo sinks, we don't want that oily film on the top of the water because it means we still have some fat present and it's not absorbed. So we're always seeking a gold standard bowel movement, and that's certainly an important goal to have. So if you haven't been observing what your bowel movements look like, I would start from today. Just have a quick look, estimate, don't get it out of the bowl and measure it. Just look at, on average, what it's looking like. It can vary from day to day depending on how you're feeling, how your digestion's going between each day. You're looking on average what it looks like. So let's have a chat about stool colour, because this can be an indicator of digestive health or ill health. So a chocolate brown is a healthy goal. It tells us that we've then got appropriate bile production and we're digesting well. Pale, so lighter brown or even clay colour may indicate possibly liver or gallbladder dysfunction, even a bile duct blockage. The colour green means that the bowel movement may be passing through the digestive tract too fast. And the other indicator of or reason for having a green stool may be low stomach acid, where we're not breaking down a lot of the plant foods we may be having, or even that we're eating too fast and we're not chewing well enough. And either way, our digestive tract is compromised. So, of course, digestion starts in the mouth and chewing. But we'll talk about why other indicators may be making your stomach acid too low as well. Yellow indicates a greasy stool, and that may be from not absorbing fat well enough. We often see this in celiac disease or pancreatic insufficiency, even gallbladder dysfunction. A black tarry stool could indicate that we're bleeding from the upper regions of our intestines. Now, it can also be if you're taking iron supplements or medications that cause black tarry stools. But if you're not taking those supplements or medications, this may suggest it's a good idea to speak to your medical doctor or even visit the emergency centre if this persists in a 24-hour period. Bright red stools suggest blood is coming from the lower part of your digestive tract. For example, hemorrhoids, anal fissures, anything at that lower end. And again, may indicate a visit to the medical doctor if that's happening. Persistent changes in stool colour, especially black or red, definitely I would promote you to visit your medical doctor, unless they're from other areas, for instance, medication as mentioned earlier. Let's talk about frequency and smell. How often should you go? Once a day, minimum. Twice a day may be fine, especially if it's still formed and depending on how much you're eating, etc. If you're going less than once a day, that is an indicator of constipation. Now, when we're constipated, we can have symptoms like fatigue, irritability, hormone imbalances, increased toxin buildup because we're reabsorbing things that should be coming out of us. On the flip side, if you're going more than 3 times a day, you may need to investigate these imbalances via a microbiome test. So if you do need a gut test, my team at the Bodyguard Clinic can help. Please feel free to reach out. What about the odour? Poop naturally has a bit of smelliness. But if it's overly foul smelling, it can be an indicator of poor digestion, especially fats, sometimes proteins that we're not breaking down in our upper digestion. Certainly can indicate dysbiosis, so an imbalance in our gut bacteria, but also can indicate low stomach acid, food sensitivities, even infections. What about gas and bloating? Now, it's natural to have a little bit of gas or flatulence, but if we're having excessive gas or smelly gas, or we're feeling that our stomach is a bit bloated, this can be from food sensitivities from things like dairy, gluten, fructose, FODMAPs, small intestinal bowel overgrowth. So this is where the bowel has an overgrowth in the small intestine, so a pathogen. Can also be when our gut motility is slow. And we often see slow motility, for example, in hypothyroidism, but it can be from a wide range of reasons. Pathogens and parasites can also aggravate, causing gas and bloating. Deficiencies in beneficial gut bacteria, that can certainly cause a range of symptoms, including gas and bloating. So, if you're frequently experiencing bloating, it may be time for a functional gut test. Now let's look at how to improve your gut and your poo naturally. So now that we know what your stool is telling you, let's talk about some solutions. Hydration. I'm always talking about hydration, what is the right hydration level for you. And I have done a separate podcast on that. So have a little search for my podcast on water. And minimum, we're generally speaking, our goal is 2 litres of plain pure water. And dehydration is top of the pops as far as constipation. Now that baseline of 2 litres, maybe you may need to drink more than that if you're having something that dehydrates you, if you're having saunas, if you're working out, if you're in a sweaty environment, if you're maybe weigh a little bit more than normal. So there are a lot of variances on those. What is the right hydration for you may need for us to establish that. So, but first step, have a look at least that you're having 2 litres, and then we can talk further about, well, what may indicate your personal need for higher water intake than 2 litres. Please be cautious because if you're on medication that is flushing out water, you may need to be more conservative with that. So again, everybody has their own individual situation there, but if you're dehydrated, the first thing we look at is what your water intake is. Fibre. We want to aim for 4 to 6 handfuls of vegetables a day, simply just to maintain a healthy gut microbiome balance. So often people aren't consuming enough fibre. Now, first step, look at your vegetables because they really come with extra value because that is topping up your nutritional levels and providing fibre. Other sources of fibre that you may not have considered and may not be including in your diet are flax seeds, chia seeds, psyllium husk. These can be included like cereals, but you can also make crackers from them, bread. There's a lot of different ways, even desserts out of some of these fantastic seeds and husks that provide fabulous fibre and a really nice content of nutrition. Now, there are some functional foods, such as fermented foods, that also support healthy microbiome. And these may not be appropriate for you if you're already over-fermenting, but we're talking about how to actually help maintain a healthy microbiome with these points. It's not necessarily about treatment if your gut is wildly out of balance. And some of these fermented foods, or what we call functional foods, are sauerkraut, kimchi, miso, and kefir. Now, these should be used as condiments, not in excess. If fermented foods aggravate your gut, it's time to investigate your gut thoroughly. Certainly don't overindulge in them because that can create a secondary issue. So just the Goldilocks level of them, please. Most people don't realize that stress also plays a role in our microbiome or gut health. So if you're experiencing stress, and who isn't, we may need to look at stress management techniques. Chronic stress disrupts your whole digestion, your microbiome, your stomach acid, and your immune response. Now, if you're not sure whether you need stress management techniques, you can look at introducing them just to help maintain your immune system and your digestion. I have a range of breathing, meditation, guided relaxations, all available from my website. So visit thebodyguard.com.au and you can have access to some of those techniques that I've recorded. They're professional recordings. Some are just 12 minutes, some are just 6 minutes, and then, of course, there are longer versions as well. Move daily. This helps so many aspects to our health, but today we're talking about our digestion. Exercise keeps the digestion flowing. The digestion is really a long tube from the mouth to the anus that is made of muscle. So the more we move our muscles, the better our digestion is. And if you don't use it, you lose it. So look at simple walking, yoga, strength training. These are great options. And if you're having trouble with your mobility, so if you've got knee problems, look at doing some of these things seated. You can also do some of them laying on your back. So there are lots of options with how we can move today. Again, Google is fantastic. YouTube has a lot of options there, especially if you've got limitations currently with how much you can move. But please, I urge you to keep moving. So some of the takeaways here are that your poop is a daily health report. So pay attention. Your body is trying to communicate. Frequency, shape, color, odor. These all tell you how well your gut is functioning. If you're struggling with constipation, diarrhea, bloating, abnormal stools, your body is sending you a message and it's time to take action. And if these simple diet and lifestyle changes don't improve things, it may be time for you to take a deep dive and investigate at a deeper level. So if you need help, my team at the Bodyguard Clinic can order functional testing and you can do it yourself, your treatment, or we can create a personalized treatment plan for you. So I hope you've found some benefit in today's podcast. Please share this. You never know. Your gut health may be fabulous, but you don't know who this podcast may help. So please share with your friends, family, and your followers. And I look forward to our next podcast.
That's a wrap for this episode of the Bodyguard Podcast. We hope you found valuable insights to help you take control of your health journey. Want to dive deeper? Visit thebodyguard.com.au to learn more about our work, explore resources, and discover how personalized care can transform your well-being. If you enjoyed this episode, don't forget to share it with others on social media. Your support helps us reach more people looking for answers. Until next time, take care and keep prioritizing your health, because your healing should be as unique as you are. Please note the information in this podcast is for educational purposes only and not a substitute for professional medical advice, diagnosis, or treatment. The Bodyguard accepts no liability for any loss or damage arising from the use of this content. Always consult a healthcare professional.